For over 2 decades, Vertex has been dedicated to creating medicines to treat the underlying cause of cystic fibrosis, a rare genetic disease that affects several parts of the body, including the lungs. Cystic fibrosis, or CF, is caused by a mutated gene that is supposed to produce a functional protein called CFTR, also known as the cystic fibrosis transmembrane conductance regulator protein, which helps maintain the flow of salt and water into and out of multiple organs in the body, including the lungs. When this protein is missing or doesn't function properly, a thick, sticky mucus builds up in the lungs that can cause chronic lung infections and inflammation, eventually leading to severe lung damage and complications in several other organs. There are many different types of CFTR mutations that can cause the disease. The vast majority of all people with CF have a mutation called F508del. When we started our work in CF, many thought we were taking on the impossible task of trying to fix the broken CFTR protein. Treating a misfolding protein using a small molecule approach had never been tested before. However, we remained true to science and worked tirelessly to make the impossible possible by engaging with the CF community, researching in our laboratories, and testing potential medicines in clinical studies. In 2006, we cracked the code when we advanced the first potential medicine into clinical development. Since then, we have developed several medicines that can benefit certain eligible people with CF around the world. Today, while about 90% of people living with CF have the potential to be eligible for our CF medicines, there are over 5,000 people who have no treatment options for the underlying cause of their disease. Regardless of the progress made, we know there's more work to be done, and we have not stopped our efforts to discover and develop the next generation of potential therapies for people living with cystic fibrosis. In partnership with Moderna, we are researching a new type of messenger ribonucleic acid, or mRNA therapy, which we hope may treat this last group of people with CF. We are committed now more than ever in our pursuit to discover new therapeutic advances and ultimately a potential cure for all people living with CF.